Welcome to the deep dive. Today we're tackling a really specific and important topic in veterinary health, cutaneous epitheliotropic lymphoma, CEL for short.
Right. It's a particular kind of cancer, thankfully not super common, but it does affect our dogs and sometimes cats.
Yeah, and we've really dug into the source material, cutaneous epitheliotropic lymphoma in animals, to get the key details for you.
Exactly. The mission here is to, understand the essentials,
Yeah.
what CLL looks like, how it's diagnosed, treatment, while also acknowledging it's complicated.
Absolutely. And here's a starter fact that kind of surprised me. Even though it's relatively uncommon overall, CEL is actually the most common type of cutaneous T-cell lymphoma we see in dogs and cats.
That's right. It stands out in its category.
Okay, so let's get right into the basics. What is cutaneous epitheliotropic lymphoma fundamentally?
So at its core, CEL is a cancer, a malignant neoplasia. It involves specific immune cells, lymphocytes, T cells, usually they start behaving abnormally. They have an affinity and attraction for the epidermis and related structures in the skin. So these rogue immune cells infiltrate the skin layers.
And are there different types or variations?
Yes, there are a couple of rarer variants mentioned. One is Sézary syndrome. That's quite serious. You see the skin lesions, but also the cancer cells are in the lymph nodes and circulating in the blood, causing leukemia.
Ah,
And the other is pagetoid reticulosis. This one's initially confined just to the very top layer of skin, the epidermis and maybe the hair follicles. It might progress deeper later, but it starts quite superficially.
so the main systems involved are, it sounds like the immune system, obviously blood, lymph nodes, and then primarily the skin.
Precisely. Hemic, lymphatic immune systems, and the skin and its exocrine glands.
Got it. And who usually gets this? Is it certain breeds, certain ages?
Well, it's seen most often in dogs. Cats can get it, but it's more common in dogs.
Okay.
Age-wise, we're typically looking at middle-aged to older dogs. The range is about 6 to 14 years, with the average hitting around 8.5 years old.
And breeds. Sex.
Interestingly, no. The data doesn't really point to any specific breed or sex being more predisposed. Seems pretty widespread in that sense.
Okay. So for owners listening, what are the first signs? What should you be watching for?
A really common finding, historically, is chronic skin disease. Often, these pets have had skin issues for months, sometimes even longer, before CEL is actually diagnosed.
So it creeps up.
Yeah, it rarely just appears suddenly. And this makes it tough because it can look a lot like other inflammatory skin problems, allergies, infections, you name it.
Right.
And the itchiness factor, pruritus, that can vary wildly too.
Yeah.
Some animals aren't itchy at all, others are intensely itchy.
So variable itchiness looks like other stuff. Definitely a diagnostic challenge early on.
Absolutely.
What about when the vet does an exam? What kind of specific things might they see that point towards CEL?
The source outlines 4 main clinical presentation sort of categories.
Okay.
First is exfoliative erythroderma. Think widespread redness, scaling, the skin might lose pigment, hair loss. It's quite generalized.
Wow.
Second is the mucocutaneous form. This affects the junctions where skin meets mucous membranes. So lips, eyelids, nostrils, sometimes genitals.
Yeah.
You see depigmentation, redness, sores, ulcers in those areas.
Right, those sensitive junction spots.
Exactly. Then there's a tumoral form. This could be single or multiple lesions, maybe red, scaly patches, maybe raised bumps, actual nodules, or even larger masses.
So lumps and bumps.
Yep. And finally, you can get oral mucosal ulceration. So ulcers on the gums, the palate, the roof of the mouth, or the tongue.
That's a pretty broad range of signs. Does it tend to appear in specific locations more often?
Well, the lesions can be anywhere, but there's definitely a preference for those mucocutaneous junctions and inside the mouth. Sometimes that's the only place you see them, at least initially.
Okay. And how does it tend to progress? Does it change over time?
Yeah, it can. With that first form, the exfoliative erythroderma, dogs can actually progress to the tumor stage quite rapidly, more so than humans with similar conditions.
Faster progression? Interesting.
And the mucocutaneous and oral forms, they tend to become more pronounced, maybe spread out a bit more over time, usually more gradual.
Right.
Oh, and there's also a rare d'Amblay form mentioned. That's where nodules just pop up, seemingly without any of the earlier patch or plaque stages.
Yeah.
Just straight to nodules.
Out of the blue, almost.
Kinda, yeah.
And the scary part, can it spread beyond the skin?
Unfortunately, yes.
Okay.
Especially in the nodular stage, it can disseminate. That means spreading to lymph nodes,
Okay.
which can then lead to leukemia, cancer cells in the blood, and in rarer cases, it might spread to other internal organs too. So it definitely has the potential to become systemic and quite serious.
Okay, so we know what it looks like, how it might progress. What about the why? Do we know what causes CEL?
That's still a bit of a mystery, honestly. The source is clear that no specific causes or definitive risk factors have been nailed down.
No smoking gun.
Not yet. But there is a theory, kind of interesting. It involves something called chronic antigenic stimulation.
Antigenic stimulations,
Well,
like the
that's
immune system being constantly poked.
Exactly. The idea is that maybe long-term stimulation, perhaps from something like chronic allergies or maybe some other persistent immune response, could somehow play a role in triggering the lymphocytes to turn cancerous.
Wow, so allergies potentially linked to this type of lymphoma, that's not an obvious connection.
It's not proven, just a theory being explored, but it highlights how complex the immune system's role in cancer can be.
Definitely food for thought.
Mhm.
So, given all the different ways it can look and the lack of a clear cause, diagnosing it must be tricky. What else looks like CEL?
Oh yeah, the differential diagnosis list is long. It really emphasizes why a thorough workup is needed.
Like what? What's on the list?
Okay, so things like ringworm dermatophytosis or Demodex mites demodicosis, they can cause similar scaling, hair loss.
Right, common parasites and fungi.
Then you've got allergic dermatitis, of course,
Yeah.
sarcoptic mange scabies, which causes intense itching. Feline thymoma-associated exfoliative dermatitis is another one in cats. For those mucocutaneous signs, vets need to rule out things like discoid lupus, erythema multiforme, or even bacterial infections like mucocutaneous pyoderma.
Lots of immune or infectious things.
Yes, and for mouth ulcers, it could be non-cancerous inflammation, like stomatitis. And naturally, if you see lumps or masses, you have to consider other types of skin cancer too.
So, ruling things out is a big part of it. What about lab tests? Blood work? Urine tests?
They're usually run standard procedures, CBC, biochemistry, urinalysis, but often they come back pretty normal,
Really? Even with cancer?
especially if it's confined to the skin or mucous membranes early on. Now, if the disease is more advanced or if it's spread, then you might see changes.
Okay. But anything specific they look for in the blood?
Well, in that specific Sézary syndrome variant we mentioned,
Oh, yes, the one with leukemia.
right, in those cases, they look for Sézary cells in the blood smear. These are neoplastic lymphocytes, the cancer cells, and they have this very distinct, convoluted, almost brain-like nucleus. They call it cerebriform. Finding those is a big clue for Sézary syndrome.
Cerebriform, like a little brain. Got it. What about imaging? X-rays, ultrasound?
Yeah, those can be useful, mainly if there's suspicion of spread, like checking lymph nodes or internal organs, or for staging the extent of any tumors found on the skin. Gives a bigger picture.
But it sounds like push come to shove, you need to look directly at the skin tissue itself.
That's the one.
Uh,
Absolutely.
hmm.
Skin scrapings, maybe a fungal culture, those are important first steps to rule out infections and parasites. But the definitive diagnosis comes from a skin biopsy.
Biopsy is key.
It is. And it's crucial to sample multiple lesions, especially ones that look different. Trying to avoid heavily eroded or infected spots gives the pathologist the best chance to see the characteristic changes.
Makes sense. Get a representative sample. So what are those characteristic changes the pathologist is looking for under the microscope?
The absolute hallmark is seeing those abnormal lymphocytes actively infiltrating into the epidermis, the top skin layer, and also into the epithelium of hair follicles and sweat glands, things like that.
Okay, infiltrating the skin layers.
Yes. It can be diffuse, just spread out, or sometimes they form little clusters within the epidermis called Pottery microaggregates.
Pottery and microaggregates, okay.
We'll also see infiltrates in the dermis, the layer below the epidermis. In later stages, this dermal infiltrate can be quite heavy and actually obscure the boundary between the dermis and epidermis.
So the structure gets disrupted.
Right. And the depth changes too. Early on, in patch or plaque stages, it's mostly superficial dermis. But in the nodular stage, it goes deeper, into the full dermis and even the subcutaneous fat.
That's very detailed. Anything else specific they look for, maybe with special stains?
Yes, particularly in dogs. They often use immunohistochemistry. It uses antibodies to tag specific cell markers.
Okay.
And in canine CEL, the neoplastic T cells usually stain positive for a marker called CD8. So they're identified as CD8 plus cytotoxic T cells. That finding really helps nail the diagnosis in dogs.
ZD8 positive. Good specific detail. Okay, so diagnosis is made. What comes next? Treatment. Prognosis. What's the approach?
The primary goal, really, with treatment is maintaining a good quality of life for the pet. That's paramount.
Quality of life focus.
Yes, because unfortunately, therapy is rarely curative. The exception might be a very rare case of a single, solitary nodule that can be completely removed surgically, but that's uncommon.
So managing rather than curing most often.
Generally, yes. Radiation therapy can be an option. Things like total skin electron beam therapy or more targeted orthovoltage radiation. Some animals respond well, and it can be tolerated reasonably well.
Okay. What about drugs? Chemotherapy.
Chemo is definitely used, though the source notes that success has been a bit limited with several protocols. Lomustine, or CCNU, is mentioned quite a bit.
Lomustine, how effective is it?
It shows about an 80% overall response rate, meaning some level of improvement. But complete remission, where the signs disappear entirely, happens in maybe 25% of dogs on a typical schedule.
Okay, so helps many, cures few.
That's a fair summary. There's also a mention of dacarbazine one case report, where a dog with lymph node involvement had a complete, long-lasting remission after 3 cycles. That's encouraging, though just one case.
An outlier, perhaps?
About a 34% response rate in dogs.
Okay.
And for dogs where lomustine fails, sometimes a combination protocol is try drugs like cyclophosphamide, doxorubicin, vincristine, prednisolone. It showed some response in a small number of dogs.
So several chemo options, but maybe not home runs. Any non-chemo medications?
Yeah, a few interesting ones. High-dose linoleic acid, like from sunflower oil, apparently showed good improvement in some dogs, lasting up to 2 years in certain cases.
With dietary fats. That's unexpected.
It is. Suggests maybe nutritional angle worth exploring. Then there's topical chemo, meclorethmine. Could help early on for localized spots.
But
Big butts. Not effective long-term, and it's carcinogenic. There's a significant risk to owners and vet staff handling it, so major safety concerns there.
yikes, okay. Important warning.
Definitely. Corticosteroids are often used, topically or systemically, mainly for symptom relief, reducing inflammation and itchiness.
Makes sense.
Retinoids, like isotretinoin or acitretin, can also offer benefits, but they can be quite expensive, which is a limiting factor.
Cost is always a consideration.
Always. And finally, imiquimod. It's a topical immunomodulator, boosts the local immune response. It has potential for localized disease, but there aren't really published veterinary studies on it for CEL yet. Still emerging.
So quite a toolbox, but needs careful selection. Sounds like specialist advice is key.
Absolutely critical. The source strongly advises consulting a veterinary oncologist or a dermatologist. They'll be up to date on protocols, managing side effects, especially with cytotoxic drugs. Getting that specialist input is really important for tailoring the plan.
Right. Given all this, what's the bottom line on prognosis? What can owners expect?
It's actually grave. The prognosis is considered serious. Average survival time in dogs varies quite a lot. Could be just weeks, could be over 18 months. It depends heavily on the stage at diagnosis, the specific form, the treatment used, and how the individual animal responds.
A wide range, but leaning towards serious.
Yes, there are rare cases, dogs and cats, that live longer than 2 years. But that's not the norm.
And how does it typically end?
Sadly, the source states that death is usually the result of euthanasia, due to declining quality of life as the disease progresses. It's a very difficult situation for owners.
Yeah, that's tough. Okay, this has been a really thorough deep dive. Let's try to summarize the absolute key takeaways for everyone listening.
Okay, so CEL. Uncommon but important skin cancer in pets. Presence in lots of different ways, can mimic other conditions.
Making early diagnosis tricky, but biopsy is crucial.
Exactly. Biopsy is the gold standard for diagnosis. Treatment focuses mainly on quality of life, managing symptoms as cures are rare.
And the overall prognosis is, unfortunately, generally guarded to grave.
That's the picture, yes.
And we absolutely need to acknowledge the emotional weight of this for pet owners. If you see any persistent or weird skin changes in your dog or cat, don't wait. Please talk to your vet. Get it checked out properly.
Couldn't agree more. Early intervention is always better.
Okay, so to wrap up, our deep dive leaves us with this thought. We talked about that theory linking CEL to chronic antigenic stimulation, maybe like allergies.
Right, the immune system being overstimulated.
So it makes you wonder, doesn't it? What role could environmental factors, or maybe just the way an individual's immune system works over the long term, play in developing this lymphoma? And looking ahead, could research into those areas maybe lead to ways to prevent it, or perhaps develop therapies that are much more targeted?
That's the hope, isn't it? Understanding the why could unlock better hows for treatment or prevention. Definitely something to ponder.
Indeed. Thanks for joining us for this deep dive.